The U.S. State Department issuing a new advisory warning Americans do not travel to China. And it's all because of fears of the coronavirus. The first human-to-human case confirmed just to the east in Chicago. This is the nation's 6th case of the coronavirus, but it's the first person-to-person transmission. So folks, naturally, when there's something new like this, a little scared.
Joining us on the phone this morning is Nola Eigner-Davis with the Polk County Health Department. More on the coronavirus, how to stay safe here in Iowa. But first, Nola, what I want to know too is what do people need to A, be looking out for to know what the symptoms are, and B, what do they do if they think they have it?
Well, good morning, everyone. Thanks for calling. Thanks for having me on to talk about this. I think the most important thing for everyone to realize is that transmission in Iowa is low. And what we're really looking for is individuals who have traveled to China and have the symptoms. So the symptoms are a fever, a cough, shortness of breath. But we're really looking at that travel history to be able to put the full health picture together.
All right, so what are the treatment to? Because that's the other, you see that there have been, thousands of cases over in China confirmed, 200 people have died. What's the likelihood of somebody actually passing away from something like the coronavirus, and how is it compared to, say, different strains of the flu?
So the coronavirus, again, is a virus, and unfortunately for viruses, there are no treatment, there's no vaccine for it. This is, again, a novel new virus, and we're still learning more about it. But chances are we see more Americans in the United States die from the flu every year. So both are scary, but it's flu season in Iowa, and flu season is very scary as well.
Now, Nola, we know that there was that person-to-person transmission in Chicago, and that, when you hear that it can be transferred from one to another, is even more scary. So does that increase the likelihood of someone in Iowa being able to get it?
We have to have someone in Iowa come in contact with the actual coronavirus. So again, this is when we're really educating people about if you have been to China, if you have these symptoms, to really talk to your healthcare provider. If you have been to China and you see these symptoms, again, fever, shortness of breath, a cough, this is when you need to call your healthcare provider and have that conversation with them so we can figure out the appropriate measures for you.
All right, Nola, and I was just in Chicago like 2 weeks ago, so that's, I guess, a little comforting to hear that the alarm bells aren't quite as immediate as if you went to someplace like China. But what's the incubation period? How long from when a person comes into contact with the virus will that virus actually set up shop, so to speak?
It's a little different, but we're really looking at that 14-day window, that 14-day time frame is what we're seeing. So again, it's really important if you have been to China to talk to your healthcare provider if you're starting to see these symptoms. And we, in public health, we really want to have that conversation with you. That's why we ask about travel history. It's so important for people to provide us that full picture about their health.
Nola Eigner-Davis, thank you so much for being with us so early this morning, educating people here at home about the concern, or maybe necessarily not necessary for concern here in Iowa.
Just more of the comfort knowing that they're very aware of it, and it's something that the CDC is following, and everybody's preparing, and a lot of times they won't even tell you what they're preparing and what they're doing, but you better know that they are, just in case something were to happen.